Did you know a disease could change how your heart works? What if sugar could hurt your muscles? It sounds strange, but it's a reality for people with Pompe disease. This rare disease affects how our bodies use sugar for energy, particularly in our muscles. Imagine your muscles needing sugar to move and work correctly, just like a car needs fuel. Now imagine that fuel isn't being used properly. The car would sputter and eventually stop working. That's similar to what happens in Pompe disease. Sugar builds up and damages the muscles, making it hard to do everyday things. Pompe disease might be rare, but it reminds us that even the smallest things in our bodies play a big role. Understanding this disease helps us appreciate the complexity of our bodies and the importance of medical research. Learning about rare diseases like Pompe is important because it helps us understand how our bodies work. It also encourages us to support research that can improve the lives of people living with these conditions. Pompe disease, also known as glycogen storage disease type 2, is a genetic condition. This means it's passed down from parents to their children through genes, which are like instructions in our bodies. In Pompe disease, a crucial instruction is missing or incomplete. This missing instruction prevents the body from making enough of an enzyme called acid alpha-glucosidase, or GAA. Enzymes are like tiny workers in our cells that help break down substances. GAA's job is to break down a type of sugar called glycogen. Glycogen is our energy reserve. When we need energy, our bodies break down glycogen into glucose, which our cells use as fuel. Without enough GAA, glycogen builds up in the cells, especially in muscles. This buildup, like clutter in a room, prevents muscles from working correctly, leading to weakness and other problems. Understanding this process is vital to understanding why Pompe disease affects the body the way it does. Diagnosing Pompe disease can be tricky because its symptoms often resemble other conditions. Doctors use various tests to confirm its presence. Blood tests can measure the levels of GAA enzyme. Muscle biopsies, where a tiny sample of muscle tissue is examined, can also reveal glycogen buildup. Genetic testing can identify the faulty gene responsible for Pompe disease. Symptoms of Pompe disease vary depending on the age of onset and severity. Infants may exhibit feeding difficulties, muscle weakness, and an enlarged heart. In older individuals, muscle weakness can affect mobility and breathing. Early diagnosis is crucial for better management and treatment of the disease. Pompe disease is considered a rare disease, affecting approximately 1 in 40,000 people worldwide. This means that out of every 40,000 individuals, one person might have Pompe disease. While it might seem like a small number, it actually translates to thousands of people globally facing this challenging condition. The rarity of Pompe disease highlights the importance of raising awareness and supporting research efforts. Understanding the prevalence of Pompe disease helps researchers and healthcare providers allocate resources effectively. It also emphasizes the need for early diagnosis and treatment to improve the lives of those affected. While there is currently no cure for Pompe disease, treatments are available to manage symptoms and improve quality of life. Enzyme replacement therapy, or ERT, involves receiving infusions of synthetic GAA enzyme. This therapy helps break down glycogen buildup in cells, improving muscle function. Physical therapy and assistive devices can also help individuals maintain mobility and independence. Living with Pompe disease can be challenging, but many individuals with the condition lead fulfilling lives. Support groups and online communities provide a platform for patients and families to connect, share experiences, and find encouragement. Pompe disease might be rare, but it teaches us valuable lessons about our bodies and the importance of medical research. It reminds us that even seemingly small disruptions in our cells can have significant impacts on our health. Learning about Pompe disease and other rare diseases fosters empathy and understanding. It encourages us to support scientific advancements that can lead to better treatments and ultimately a cure. By raising awareness, advocating for research, and supporting those affected, we can make a difference in the lives of individuals living with Pompe disease. Remember, knowledge is power, And in the case of rare diseases, it can be the key to unlocking hope and improving lives. Like, share, comment and subscribe, and